4 o'clock, COVID-19 is an equal opportunity virus.
It certainly is. Young, old, poor or rich, the virus, it can still kill you, but some ethnicities are at a higher risk for catching COVID-19. New at 4 o'clock, CBS 46's Yasmina Alston breaks down the higher cumulative rates among Hispanic and African American children.
Well, we know that children can get infected by COVID-19, and now we're learning from the CDC the hospitalization rates for when children do get severely sick. The American Academy of Pediatrics says over 338,000 children have tested positive for COVID-19 since the onset of the pandemic. More than 97,000 of those were during the last 2 weeks of July. Now, in a recent report, the CDC focuses on children infected by COVID-19 and the hospitalization rates. Through their research, they found that COVID-related hospitalizations for those under 18 remain relatively low. However, Hispanic and Black children were hospitalized at a much higher rate than white children.
There's certainly some concern that those children have underlying health conditions that put them at higher risk for getting severe illness when they do get infected.
According to the CDC, since March 1st, COVIDnet identified over 500 pediatric COVID-related hospitalizations. They continue to say children can develop severe COVID-19 illness. During their surveillance period, 1 in 3 children were admitted to the ICU. Again, Hispanic and Black children with the highest hospitalization rates.
We know that children can get infected. They are not immune to getting infected in the first place.
And as the CDC warns that children are at risk for severe COVID-19, they say reinforcement of prevention efforts is essential in places like daycares and schools. In Atlanta, Yasmina Alston, CBS 46 News.